Doctor, do you think I'll need to be on treatment for the rest of my life?
Lupus is a lifelong illness, but treatment with medication is not necessarily lifelong. We usually try to obtain improvement, back off, induce remission, and once remission's been there for several months to several years, then we can back off. And the majority of patients with non-organ threatening lupus eventually get off medicine, but it can be 5 to 10 years before this happens.
When will the treatment begin to improve my fatigue, and will this rash clear up quickly?
Treatment can improve fatigue immediately if it's a steroid and if the fatigue is from lupus. Otherwise, lupus treatments can take anywhere from 1 day to 3 months before they start to work. Sometimes partial improvements are noted, and we have to add a second drug like a steroid or antimalarials with methotrexate. And so the whole process is usually 3 to 6 months before patients notice a huge difference.
Well, how is this going to affect my life?
Fatigue can make it hard to function, but one has to understand what's the cause of fatigue. Is it due to lupus activity and inflammatory activity with rashes and swollen glands and swollen joints? Or is the fatigue because you're anemic from having lupus with heavy periods and taking medicines that lower hemoglobin? Is it due to the fact that one is stressed? Is it due to the fact that one is taking other medications? Is it due to other causes, let's say a low thyroid or bleeding from the gut or very heavy periods? So have to figure out why fatigue is present before we can answer the question on how to improve it.
So what can you recommend I do to feel better?
I think the best way for patients with fatigue to feel better is to pace themselves with periods of activity alternating with periods of rest. Because if a lupus patient goes many, many hours straight without a break, or if they catastrophize and put themselves in bed all day, neither of those will help fatigue. It's very important to have a positive attitude and to try to perform activities as long as there are frequent rest periods.
So if I take the treatments we've discussed, will I still have symptoms?
Most lupus patients have some mild symptoms of fatigue and aching even with successful treatment. Some don't, who are in remission. Patients with primary skin disease tend to have very little fatigue. Patients who have other more constitutional complaints such as fevers, swollen glands, and aching, their fatigue comes and goes. It's important to get a good night's sleep. It's important to have a healthy diet, and it's important to do at least isometric exercises where all the joints are arranged and strengthened with activities such as, let's say, Tai Chi, yoga, or Pilates.